part of the success that you've been met with is a lot of these partnerships, and you're about to break some news on our stage. Tell us about one that you're announcing now.
Sure. So this afternoon we're announcing a partnership with Google to develop the first comprehensive set of AI credentials for clinicians. And we believe, from where we sit, that the technology and the pace of the development of the technology will move as rapidly as lots of other innovations have, but that the critical contingency that has to be solved for is workforce readiness. How do we get clinicians ready to adopt these technologies in ways that allow the investments to deliver the returns that delivery systems are looking for? And so using AI, Google Cloud, we're going to develop a series of certifications, both in general AI fluency, but also in domain-specific tools for clinicians, nurses, doctors, imaging techs, and others. And so the first of those credentials will be available in 2026, but we're super excited about where that goes and our ability to learn more about how to get clinicians day one ready when they leave our institutions.
And that's something that I think a lot about. There's this critical shortage of healthcare workers, but now we're hearing that some students are hesitant to even enter the field because of fears that AI can make certain jobs obsolete. So is a partnership like this, upskilling from the point of entering a tertiary level education, pretty key to recasting that narrative? Or how do you think about job security in the way that you're training people through your different universities and different certification programs?
Yeah, so we spent a lot of time thinking about the appeal of these professions and what dynamics might dilute that for students. And everything we know from the surveys of clinicians today is that the #1 driver of burnout and career dissatisfaction are the administrative burdens associated with practice. And I think the stuff that you guys are doing and others will go a long way to actually driving up professional satisfaction in ways that keep our institutions and these professions relevant. Everyone psychologically wants to know whether AI is going to be a complement or an augment to what they do or a replacement for what they do. And as we sit here today, whether it's a physician, a nurse, a veterinarian, even a social worker, all the evidence suggests that AI is a fantastic complement, and we should be encouraging the adoption of these tools because of what they can do for the experience that we all have in U.S. healthcare.
There is an air pocket in the talent pipeline. You're seeing it in the hospitals, you're seeing it as you train the workforce, so where is that?
Can you elaborate on what we mean by an air pocket?
I think that we're starting to see there are some jobs that are going to be made obsolete within the healthcare sector. So are you redefining the way that people think about the roles that they should be aiming for? Like, I'm talking to students who are afraid to be a computer science major because they're going to be unemployable at the end of a $200,000 education.
Look, I think every major tech innovation comes with some labor dislocations, but I do think that the human element in healthcare, particularly in the way it drives trust between the clinician and the patient, is something that can't really be replicated by the machines. We have a partnership with Hippocratic AI out in the Bay Area where we've developed curricula for their voice-based agents, which can interact with patients on a host of non-diagnostic issues. The folks love interacting with those voice agents. They love the dynamism of the conversations, but at the end of the day, part of the reason they're confident in that tool is because they know there are human nurses and physicians checking on those conversations and ensuring that they're compliant with the standards that the clinicians expect. So I don't think there's reason to believe that wholesale professions will be eliminated. I think new professions will be created by the technology, and I think for us, clinicians will have a chance to do more of what they join these professions to do in the outset, which is be at the bedside caring for patients.